Hello friends, this is a short video demonstrating Allen's test, and this particular version is done after the patient is anesthetized just before the surgical procedure. The first step is to palpate and confirm the position of the radial artery pulse, and it is marked. And then a pulse-oximeter probe is applied on the thumb. And now fingers are placed over the radial and ulnar arteries. And you have to watch the machine for the waveform. You can see the normal waveform, and when both the arteries are clamped, the waveform goes straight. And the pulse oximeter reading will disappear. Yes, here it disappears. And then you release the finger pressure on the ulnar artery. And this will be seen as a return of the waveform. And very soon the pulse oximeter reading also will appear back as 100. So that is a Allen's test.